Today we will be discussing about a dorsal scapular nerve. Dorsal scapular nerve is a pure motor nerve. It arises from C5 nerve root where it passes through the scalenus medius muscle. It passes through the substance of scalenus medius muscle and it supplies two muscles from it as it arises from C5 spinal root. It supplies levator scapular muscle and rhomboid major and rhomboid minor muscle. These two muscles help in elevation of scapula and medial displacement of scapula while shoulder movements. How do you test rhomboids? Ask the patient to place the hand over the hip and retract the scapula. Means ask the patient to place the hand over the hip and move your elbow backwards, and examiner wants to place the hand over the elbow against resistance when the patient moves his elbow backwards. Or the other method is ask the patient to lie down and arm should be rotated backwards over the back and ask the patient to lift the hand above, and we have to push, examiner should push the elbow downwards. This is a method to test rhomboids. And what happens when the dorsal scapular nerve is involved? It is that the dorsal scapular nerve is involved in mostly in rhomboids. The palsy occurs mostly in bodybuilders, and it can also be seen in upper brachial plexopathy where the involvement of rhomboids it localizes it to the proximal portions of brachial plexopathy, and it is also seen in entrapment neuropathy as a part of entrapment neuropathy when it passes through scalenus medius muscles. And what happens when there is a dorsal scapular nerve palsy? Normally it is an elevator and retractor of scapula, means the medial border of the scapula is displaced medially when rhomboids contract. So if there is dorsal scapular nerve palsy, rhomboids are weak, so there is a lateral winging of scapula, means the medial border is displaced laterally. In mostly the medial border and the inferior angle is displaced laterally. Thank you.